being impressed by Suzu's photocopy memory. He introduced the speakers. There's no exception here today. Can the people in the other part of the audience hear me? Okay? 听不听到吗? Okay. So here's the title of my talk and online the next 20-some minutes. And I was very surprised that to realize that many people before this COVID-19 pandemic didn't know about NHI. You know, heard NHRI-NTHU. I was very surprised, but hopefully not anymore. So some of them are in this audience. So before we get into the effort being made by NHI in the last 10 months or so, I want to give you a brief introduction about NHI. We were founded in 1996, and currently we have about 8 research institutes and 5 research centers, approximately 150 investigators and physician scientists, and annual budget around US $90 million per year, personnel need per year. To some extent, we're modeling after the NIH in the United States, having both the intra and the extramural programs, but we're different in some way, in particular, in that NHI is mission-oriented in the sense of serving as a think tank for the government, the Ministry of Health and Welfare in particular. So in terms of structure, we, as I mentioned, with 8 institutes and 5 centers, we categorize into 3 different groups. One in terms of public health and the policy research, and the other by medical industry and innovation research, and the third one is basic translational research. So as I mentioned, here's the demographic figures in NHI. And our mission is really to advance the health and well-being through medical research. In terms of strategies, I'll get to this 3 parts in seconds. I want to just mention that so part of our mission is to integrate, to coordinate the biomedical research efforts domestically, and also hoping to establish collaborations with others within Taiwan, but internationally as well. And so what we're hoping through research, we're making scientific, societal, and industrial impact. And so here are some of the unique features at NHI. We're the only mission-oriented biomedical institute in Taiwan. So through basic and translational research, we're tackling important diseases in Taiwan, such as cancer, which remain #1 killers for the last 37 years. Also, with that finding that through evidence-based research, we're making health policy recommendations to the government. Also, through technology development, we bridge the gap with the industry as well. The other unique features that NHI, this is a question that we ask from time to time, how's NHI different from academic Sinica or universities in terms of type of research? I think that one difference is that we're helping government dealing with the national health crisis. In other words, if something happens, such as COVID-19 this year, we advocate to stop the work, to work with the government dealing with these issues. So SARS in 2003, H5N1 in 2005, and dengue fever in 2016 since, and of course this year is the COVID-19. In addition, we also serve to coordinate and create national networks. For example, the TCOP, this is the Taiwan Cooperative Oncology Group for multi-center cancer clinical trials. And TSAS, the Taiwan Surveillance of Antimicrobial Resistance for monitoring antibiotic resistance. And also more recently, National Biobank Consortium in Taiwan. take the daily figure as an example. So you may recall back to 14 and 15, there's a big jump in the number of dengue fevers, especially in the three cities in the south, Pingdong, Kaohsiung, and Hainan. As we're talking about 40,000 in 2015. And in 2016, the mosquito disease-borne research center was created in NHRI. So working with the CDC at the central government level, but also the local health officials, we were able to work together to actually to lower the numbers to the double, the single double digits in the last few years. So I'll move on to the main topic, which is COVID-19. And this virus was first reported on January 7 this year. It was 2019 and COVID by the WHO on January 12. And the disease caused by this virus was turned COVID-19 by WHO on February 11. As of November 20, more than 56 million, actually today there's more than 60 million individuals worldwide have been infected and more than 1 million people diseased. In Taiwan, was found the number as of yesterday was 651, and number of deaths 7, respectively. So I'd like to spend the last the next 15-20 minutes talking about the work effort NHRI have been made internally and externally. For the interest of time, I'll be just focusing on the work from the colleagues of the three institutes: Institute of Biomedical, Biotechnology and Pharmaceutical Research, Sinica, and the National Institute of Infectious Disease and Vaccinology, Kung-Yee. By focusing on these five different areas. The first one, the synthesis of remdesivir, is really the secret. The rationale is that based on the article published in the New England Journal of Medicine, which is based on sample size one patient, the first patient identified for being infected in Seattle. And they found it was reported that the remdesivir was very effective. And that led to a tremendous effort being made in terms of conducting the clinical trials and so on and so forth. And even though now it seems that the efficacy is not as strong as one hopeful. But anyway, back then, and so we asked the question, with that information, what can we do if the medicine was not made available, assuming that was effective? We can't just assume what may have happened 10 minutes later. And this is really a reminiscent of deja vu of Tamiflu 205. That's cardiology. And there was a time, just very briefly, that the WHO recommended that each country should have stored 10% of the Tamiflu in each population. But the Roche was a very strong edit, and so make a tremendous effort to refuse to sell the amount to us. So NHRI, we team worked together for 18 days, which we have the synthesis of the Tamiflu. It was leverage to negotiate with the Roche. Eventually, they sold us the amount as we request. So in a way, this is the effort about the public reinsurance and EDC. So results mission complete, actually, at this time. So going back to this time, we have two teams working together independently. And actually, we have this rate of synthesized in 19 days. What the lessons been made? I'm not going to look at from the technical point of view, but really from more fundamental and spiritual point of view. The lesson we learned is that we have to be in Chinese consulting and then we have to be foresight as what we have to face in life. And we have to take extra action as soon as possible. In fact, on February 5th, they start looking for the necessary material, because this is something that everyone wants to have. And Kung-Yee NHRI-NTHU, indeed, they work very, very hard, and we have very average 3 hours sleep a day. And the other lesson I think is important is Liang you don't have something like this happen. So what you do regularly, you do something different, but similar in the sense that maybe deal with different disease. When the focus is on this particular disease, hoping they can switch the gear and maybe using what they have practiced on a daily basis to be useful right away. So this is the 3 teams that I mentioned on these two pharmaceutical research. Developing new rapid testing kits. The rationale is what if virus spread across the communities? Or what if we decide to reopen the border for economic consideration? This is the issue we debate constantly. And so, as a result, colleagues developed antigen detecting test in conjunction with the colleagues from the Institute of Preventive Medicine, National Defense Medical Center, which our Vice President was the President before he joined us. So what the lesson we learned? Again, back in January, I was told our colleagues, after the report by the WHO, they find out that there's a striking similarity in sequencing with the SARS-CoV-1, which is the antibody extract variant in 203, which actually can be utilized to create this testing. And the other thing is that collaboration across institutes is essential. And you can't just rely on one institute. Very often we need to have collaboration. But to do so, I think that the key thing is mutual trust, which we have in this example. There will be new vaccines. So when it becomes epidemic, it seems to be the case, having vaccine available is crucial for health, economic, psychosocial, and educational considerations. I want to echo what the Dean Gallagher said, that there's a tremendous mental health impact worldwide. I was reading the Baltimore Sun recently. They reported a survey done by CDC in the States, that in the state of Maryland, which Hopkins was there, the number of individuals who have depressions is come to 1/3 of the population of the state, which is really tremendous. So with that, what happened in NHRI? We developed 4 different platforms, peptide and DNA animal subunit, for simultaneously developed. And after the result of the animals study, and it was determined that the DNA vaccine was obviously more effective, so it was chosen for clinical trials. So we are collaborating with one of the local companies for clinical trials. So again, one of the lessons we learned, as I recall back to February 20, President Tsai visited NHRI, and our Vice President gave a very good, excellent presentation about the work at NHRI. He gave one of the tiny story, but I think it's very revealing, that one of the colleagues was about fish per PhD thesis, and actually she's determined to get it done in the last 6 months. But then she was called upon by her boss that we need her. We need to carry out the work at the P3 level laboratory, and she's one of the experts. So she wrote back and saying that what I have done, so this is one story showing that actually this is the recognition of our colleagues about how important the role that the NHRI can make. And little is known about this worldwide. The point I'm making here is that now we look at the worldwide, there's several different approaches from Moderna, from Pfizer, AstraZeneca. The different approaches, again, suggesting that we know very little about this approach. So different companies take a different approach. You take a shot, try different approaches. there's no exception here as well. And being a research institute, we felt that it's the opportunity for us to learn as much as we could about this virus, be prepared, praying for the future. If something similar happens, hope it could be something can be learned here. And one lesson we have here is maybe we should develop about this approach for the future as well. Working in drugs, again, when it becomes epidemic, and having drug available in addition to the vaccine is crucial, especially if the quite a number of individuals diagnosed with COVID-19. So at NHRI, both artificial intelligence assist and Russian drug design approach was taken to identify the existing drugs, reposition approach for fighting COVID-19. Also, there's a new drug being developed, currently being developed, considered to be promising, at least in Taiwan, which probably will take time as we go through a clinical trial, probably won't be available until a couple of years from now if we're ever successful. Again, the lesson is that we really need the teamwork working on the basic point of view of the whole piece of the clinical studies. And always helpful to have a backup strategy for discovery. We can't just rely on the desperate interview. Apparently, it looks apparently that's not the optimal solution in terms of treating patients, especially as well as severe. The monoclonal antibody. Again, this is one of the hardest topics now, but internationally, is to develop the therapeutic monoclonal antibody that could be used to treat various virus. And again, our colleagues work on that as well, and we find the potential therapeutic antibody, and which is to neutralize the SARS-CoV, not just 2, but hopefully 3 and 4 in the future as well. So I think it's a very important finding, and it's a little hamster model. The lesson that we learned is that since long processes, again, this is based on the antibody we extract back in 203. And always, while we're learning history in high school and in college, there's always a lesson that the past can be learned. And also, good animal models platform are important for developing vaccine drug and testing as well. Okay, so that more or less about the internal efforts in China in a nutshell. How about the external one? On February 27th, the National Health Control Center, Kung-Yee was elevated to level 1, meaning at the 行政院 level. And at that time, the Research and Development Division was created with myself appointed as head of the division. So ever since March 3rd, we have a regular weekly meeting. It's every Monday afternoon at 1 o'clock. Through the concerted effort, a group effort to bring up-to-date information on international and domestic research development for rapid testing, vaccine, drug development, and for epidemiological monitoring. Okay. And meanwhile, provide advice to the National Health Control Center head on matters pertaining to the epidemic. So one example is that against several months ago, thinking ahead, what if we need to, we have the so-called site. Okay, so how can be done? How should be done? Should be done at the clinics level or the hospital level, things like that. So that we have to form a special advisory group through discussion and make recommendation to the NHCC. So here's the diagram of this division, the R&D division. We have the General Director of Sales, the PFDA, and the Liang from Academician as vice head of this division. And we divided into 5 different subgroups in terms of rapid testing, drug, vaccine, and epidemiological predictions, and the technological supporting platforms. And this is being headed by our Vice President, Sizu. And we see that we have involvement from the 3 different governmental departments, not just the health and welfare, but also the science, technology, and the economic affairs. Okay, so here's some of the main responsibility, which I will not repeat here. Also, we have experts from National Taiwan University, some cases who provide a lot of very insightful comments to us. So here's just some photos, and I was asked to give presentation to the public about what we've done in Taiwan and internationally as well, several months ago. The other one is that, as I mentioned, one of the subdivision is headed by our Vice President to provide a technology support platform for academic and industry on drug testing, vaccine, and drug development. Also provide through the biobank consortium, which I mentioned briefly, the serum sample and country information of the infected individual who collect for research and biotechnology development purpose. And that actually has found this become a very important aspect of the government, especially now that we carry out the clinical trials domestically. We have a standardized procedure to hoping that the finding will be consistent. And this turns out, I think that this consortium plays an important role. And finally, the diplomatic efforts. Ever since March, we have hosted the visit of the Foreign Office of many countries, the European Union, Polish, this AIT, American Institute in Taiwan. You want to guess what the BOT is? Not the BOT, it's a field operation, and this is the British office in Taiwan. France, Canada, and many other European countries, Australia as well. And mainly, the main interest in our rapid testing and the vaccine developments, and the possibility of collaborations with their own academic and communities and industry as well. So I think the lesson we learned here is that we are grateful that they show interest in our work. It also shows that the infectious disease in particular have no boundary across the affiliation. They really need to work together hand in hand to tackle this crisis. So this is some photo just to show that what I just said actually was true. Okay. So in summary, I think that for COVID-19 is far from being over. And if you look at the numbers, the effect is increasing, especially in Europe, in America and South America. And I think that Taiwan has done a good job thus far in keeping its impact minimum. Probably because we have a very stringent border control from outside. Also, we have learned the lessons in the past, the SARS and Q3 in particular, in building the infrastructure and regulations. For example, we have this isolation ward that being set up that could be utilized immediately, and that we have the change of laws allow the CDCs, the Center for Disease Control, to hire infectious disease physicians to work closely and regularly with the CDC. Also, I think that one important aspect could be easily ignored is the public health practice, washing hands, wearing face masks without the social distance should be has to be reinforced and followed. And this, to me, is one of the reasons why I think we're doing well. And I'm sure that some numbers suggest that there's a side benefit of such practice. The number of the EV71 cases supposed to rise up every April and May. Actually, it's going down. And I think because of the practice of wearing the helmet, wearing the face mask and the washing hands. So in preparing for the next wave, I think that the vaccine drug components are crucial. I mean, but meantime, maintaining this public health practice is also essential. Especially now before the vaccine become available. And NHRI will remain in action whenever and wherever needed, after all, as public launch.